Well, you know, having having been using a microscope for about 26 years now in restorative dentistry, you know, it's really easy to understand the ergonomic benefits of having a microscope versus using magnification loops. Just physically being able to sit up straight and you know, having good posture and being able to get your magnification as well as to be able to get your documentation. I mean, the benefits are huge. And the only reason for thinking about going with a digital option, and there are many reasons, but one of the biggest reasons really is for patient positioning. Because still, whether you're with loops or whether you're with a traditional optical microscope, the biggest challenge that you have is that not all patients can lie flat. I mean, especially older patients or patients with neck issues or patients with vertigo issues and things like that. And so we have some patients who can't lie flat. We can't treat them in our office because for that patient to be working, or for us to be working on the microscope with a patient like that, they've got to be pretty reclined.
Right.
The difference here, and the reason is because even with inclinable binoculars, which is what we have on our 5 global microscopes, we still can only incline those binoculars so much, and the optical path has to be somewhat straight from our eyes to the area of interest. The difference here is the ability to take the cameras and move them to an infinite positioning. It wouldn't be necessary for a patient to lay back. In fact, a patient could be at a 45-degree angle. They can almost be sitting straight up.
Absolutely.
And you'd be able to take your optical microscope, your digital microscope, move it to positioning, and still have good ergonomics as the operator. That one feature alone is huge. And of course, the other advantage is the ability to work with the magnified image without having to learn the stereotactic control of working on a microscope. The hard part of getting our dental hygienists and even our dental auxiliaries to be competent on a microscope is they're not using it every single day, day in and day out. Surprisingly, having just sat down with this new modification of the MoraVision microscope with this little 7-inch screen, doesn't require 3D glasses to be able to see the image. You get your 3D image directly from looking at the screen. You can be wearing safety glasses. You could be wearing magnification, low-level magnification to bump the magnification up, but it's nice because wherever you're going to put the head of the MoraVision camera, that's where you're going to see your image. And the other advantage is this is all one package, so you're not going to have a large 60-inch screen at the foot of your chair. There's more cabling when you do that. So this really gives some interesting options. It's an interesting innovation that has potential for every dentist, every restorative dentist. I mean, any surgeon, anyone doing anything where they want to see up close and document up close and not have to wear optical magnification. I think it's very intriguing. Even though I like the zen feeling of being on a microscope and having no peripheral vision, and therefore none of that visual noise from peripheral vision, that you'd be giving up. But still, you could probably put on some glasses if you wanted to have some blinders put on to reduce peripheral vision if that was something that really bothered you. I find that very pleasing working on the microscope, is looking at the task at hand and not seeing the auxiliary or anything else going on in the treatment room that might be somewhat distracting from the task that you're trying to perform. I'm surprised that this screen looks as good as it looks. It's very crystal clear. It's extremely lightweight. It weighs a few ounces. So it has a lot of potential in terms of mounting because you don't have a lot of weight to deal with. You're not going to have a support arm. You're not going to have heavy power cabling, really lightweight cabling on this. So I think maybe, Assad, you have a new vertical potential in interest for users because they don't have to make a commitment to really reconfigure their entire operatory to be able to take advantage of MoraVision. That in itself would be very attractive, I think, and since I'm one of the first ones to see this monitor, I'm certainly very excited for you and intrigued about the possibilities for restorative dentists and those that aren't willing to change their entire operatory configuration, but just clamp on a self-contained package that has the camera and the video monitor, and of course the capability of adding another monitor if you wanted to for the auxiliary. It could be a 2D monitor in the appropriate location, but it looks very intriguing. So bravo for finding it.
Thank you, Mark. You always challenge me, and you make things better. Thank you.
Well, we'll see. Thanks.
Yeah.